Thank you for joining us. I'm Dr. Dino Prato, founder and CEO of Envita Medical Centers, here with Dr. John Oertle, one of our also chief medical directors that works with our patients. And today we're going to go over another wonderful case by Envita of basically was once an early stage cancer that became returned many years later. And then the patient came to Envita with metastatic cervical cancer. So Dr. Oertle, let's go through this. This is another great case that we can review and talk about how precision oncology made a difference here.
Happy to do it. Absolutely. So this is a 65-year-old woman who, unfortunately, she was originally diagnosed with a stage 2B cervical cancer in 2007. And she was treated with chemotherapy. She had a radiation to the actual localized area. And at all intents and purposes, it was a positive treatment response. However, then in 2022, fast forward all those years, she started experiencing abdominal pain and she went in to see the doctor, and the imaging actually revealed that the tumor was no longer contained just to the actual cervix. It had now spread all throughout the abdomen. And unfortunately, this is where she had what's called omental implants, which again, when it's in the omentum, these are very difficult to treat cancers. Very difficult to treat cancers. Now, we've seen cervical cancers have reduced in we don't see cervical cancers very frequently anymore because they're reduced in the quantity of late stage because we have a lot of screening for cervical cancer. But when cervical cancer turns into a late stage, it becomes very aggressive, very difficult to treat. And especially because of the location of where this is at. This is in the abdomen, and it's in that area of the omentum that doesn't respond well to standard care therapeutics.
And I think what's important in this case is this is 15 years later. So this woman, got standard care. It was an early stage cancer, had a good response years ago. 15 years later, we're going to see how this cancer goes forward. And in fact, I'm going to bring up this next slide, which talks about the mutations. And what I think you'll see here, one of the reasons these mutations are so high is you have a 15-year ability for cancer to be developing all through her body, still growing through these mutational changes. So I'll let you go ahead and go over this. You can see the mutational burden. These are genetic mutational tests that Envita runs. Obviously, a small part of a full test profile. We're just kind of trying to zoom into some key points. But this is not standard. It's not run in standard oncology, and it's unique to what we're running right now. And of course, amongst a lot of other things that we do, that's different. But it shows you this mutational burden.
Well, when you see a very high allele mutation right there, the percentage, the 51.1%, that's a very high level, and that is a very poor prognosis. So this is where whenever there's patients that come in, even if it's a 5%, 10%, that's still elevated. But when you get 50, 70, the worst I've ever seen is around 90%, just a little elevated above 90%. When you start to see these elevated percentages, that's a very poor prognosis. And so it's really important to be able to understand that. Now, granted, it's poor prognosis, meaning that it's very strong urgency to be able to be treating and to be able to actually get moving on actual care because of how aggressive and how advanced the tumor is actually within the body.
And this particular mutation, you're going to see potentially associated more with colon cancer. So sure. When you see this, you got a history of more polyps and et cetera in cancer. But here, what we're seeing is a very high mutational burden related to ovarian, to this particular Correct. Cancer type here. So it's important to understand the uniqueness of every patient, right? This might carry more weight if this is just a colorectal patient, but it carries a lot of weight to us because it's a mutation of all of these circulating tumor cells that were collected from her, right? So it's giving us pretty important data of her mutational rate. So I'll go ahead and let you continue here with her CA125, which is another marker.
So CA125 is a very conventional standard tumor marker. It's usually more commonly ran in ovarian cancer, but in this case, again, it was elevated in her. Hers was very high, and what you see again back, it had gotten up to 89.5. This was very early on, and it's aggressively growing, and it's the rate of speed of growth is quite significant when you actually see in just a month that it actually jumps in that kind of a range. Again, this is a strong concern as far as this goes with how things are going for the patient.
Yeah. And, going back here again, so you have these two markers. We're going to go a little further. Can, colon, lung, cervical, all have association with these genes. But at the same time, this being 51.1, think about how many years she was, quote, cancer free, but that actually
Sure.
was growing in there. Did you think of what were the causative factors that weren't addressed in the initial treatment? What were the immunological factors not addressed where this maybe could have been put to bed 2007 so she never had to progress? Let me move on here. So here's the imaging of her PET scan where you can see, just so people understand, the imaging that makes sense at the very bottom, that solid in the urinary bladder, that's just an artifact. That's just a collection of the contrast. Up higher, the kidneys, but it's the in between. It's all of these activity, these dark dots in the middle of, if you will, the abdominal region. These are where the metastases and the cancer is. If you want to, do you have
That's
anything else?
correct. So this is showing that the cancer is everywhere throughout the abdomen. It's in the lining of the stomach on that omentum. It's in the it's again really all over in that abdominal area. And so you have a lot of cancer actually visualized in the abdominal area. You've got an elevated tumor marker, and you've got a very high level of cancer fractionation, all pushing towards, this is a very poor prognosis for this dear woman coming
Here's
on in. Now
here's a reading.
the
Yeah.
thing is with Envita's treatments, what's really important is that we are one of the specialists in very difficult cancers, in the cancers that have poor prognosis, in the ability to be able to actually see late stage. Because again, this is where we see these patients. We see, every patient will be better off being able to have a precision approach. But what's really important is that there's not a lot of other options for these patients in the conventional system. And so they come to see us because there are options with a precision approach. And what you can see is that producing an actual precision treatment plan that's an integrative with the best of conventional and the best of and integrative modalities, you can see this incredible responses that we start to be able to see. But again, like this is just what you're seeing here is the impression from the radiologist who read this. Again, she's also having what's called a pelvic ascites, which is this fluid in the abdomen. These lesions in the abdomen are leaking fluid. It becomes very uncomfortable. It becomes difficult to digest. You can have other issues like small intestinal bowel blockages. And so there's all these complications that can arise with this, not to mention pain from all of these actual
Sure.
effects. But it just is showing that this is a real difficult case upon coming in and presenting to Envita.
So here we look at her treatment plan because we're going to see the results here. And we looked at the GTF. So based on those genomics, transcriptomics, immunoprofiling, all that detail, the treatment plan gets built. And with immunotherapy centralized care, in this particular case, there was the utilization of a PD-1, but which is a type of immunotherapy, right? And so then you can start to see the treatment plan here, including SIPI. So I'll let you go over that
But you'll
because
see it's not just the PD-1, SIPI, or the chemo immuno precision injections. And these are injections with our algorithms of direct chemotherapy using, again, the catheter the size of your hair to be able to go directly, having 100% bioavailability into the actual tumor, to be able to actually administer your chemotherapy that is right for you. And it's also immunotherapies that are able to actually work in concert with those adjuvants that allow for the actual chemotherapy and the immunotherapy and the
yeah,
immune system
and
to
you're
be able to
sparing
function well.
you're sparing the body because you have to understand that when you give the conventional high dose maximum therapeutic chemotherapy, you increase the risk for more mutation, you increase the risk for weakening of immunity, more resistance, and that's counterproductive. When you have the right targets, you don't need mega dosing. And the proof of that is we'll show you what the outcomes are. That's the proof. But beyond that, the immunotherapy is really the key here. And if you look at with SIPI, when you use a catheter the size of your hair, we mentioned this many times, you go direct to the tumor, giving the chemo right where you need to and sparing the rest of the body and creating an immune system response that becomes systemic to the rest of the body, which is absolutely critical. And here, I'll just keep going on. You can start to see as we do treatment, look at the tumor markers. They speak for themselves. You can see them dropping beautifully. patients responding very well to care here. You can see the numbers from left to right just dropping right here in the slide. You can see it going all the way down.
It's just beautiful. I mean, we see these cases at Envita, but again, it's every time we see this, it's just a great celebration because again, this is why we do what we do, to be able to actually see these kind of results, to take a cancer case that could result in a lot of complications and a lot of difficulty and be able to see it respond so swiftly and beautifully. Again, this was a great joy to be able to see this within this.
Well, let's just look at the imaging. So, Dr. Earle, I'll let you.
Well, here you go. You can see it right there. You see the image off to the left has a lot of those large concerning cancers that are all littered throughout the course of the abdomen. And what you see on the right is that they're almost completely gone. Absolutely completely gone.
I mean, we're looking at almost
as any oncologist. This is a joy to be able to actually see this in.
And here you're looking at maybe 7 weeks. I mean, that's a dramatic shift. So
You have
all of the abdominal metastases, omental, which is very difficult to treat. And here you have a patient who is responding very well to care. Disease is manageable already at this point, and the quality of life is greatly improved, right? This is a case, right?
This woman, she had cervical cancer diagnosed back in 2007, and it returned incredibly aggressively and was a very poor prognosis with high levels of mutation fractions and a high tumor burden and a high tumor markers. And what you see is in short time, in short order, with the right precision plan that included a genetically targeted fractionated chemotherapy, that included CIPI, or the chemo immuno precision injections, and an immunotherapy centered focused plan, along with the other phytotherapeutics that work in concert with the body. This is a holistic plan that's able to provide this kind of a treatment response, but it's all based upon the individual data points for this woman.
This is why I say we're about a decade ahead, because the data is there, the medicine is there, the availability is there, but it's just not in the insurance billing codes. It's not in the standard of care practice. This would be considered. But this patient, as we see with many of our patients over and over again, it makes a huge difference to have the right targets. It makes the huge difference. It's the only way, after years of our doctors, our clinical experience at the clinic, that we proceed, because to have more information makes a lot of difference, and to be able to do something with the information. So even if you can strong arm your doctor to run one genetic test, it's not, they're still following NCCN guidelines. Or if you're in an integrative natural doctor's practice, they just have a high dose vitamin C or curcumin or whatever. These are not the same thing as these targets all across the board, which make a huge difference. The picture's worth 1,000 words. You can say whatever you want, but the outcome is there. And that's what we aim for with every one of our patients, with the details of better targeted precision. Every person deserves this. Shouldn't just be an Envita patient. Everybody deserves this kind of care. So, John, I want to thank you for joining me. Unless you have anything else you want to add to this before, So, yeah, I think the picture speaks for itself. And to those of you who are watching, may the Lord bless you on your journey to healing. If you have any questions, reach out. We're here. Our team is happy to talk to you and share the work that we do. And again, we wish you all the best on your journey to healing. Dr. Oertle, John, thank you for joining me. And we'll see you on our next case presentation.